Good morning, dear friends. In fact, Sushma and every one of us here are just because of her. Her contribution, directly, indirectly, immense, incalculable. As Dr. Kalpit was telling, she made many people powerful with education, with knowledge, with experience. And more than anything else, what is the greatest asset for any individual is self-confidence. All of you can definitely present about a simple drug very well here on the stage, but you would falter because you lack confidence. If you have self-confidence, you can present better than even established stalwart. So she has given the platform, knowledge, experience, support, and more than anything else, as I said, like confidence. So my salute to her. Put it in slide show. Right, slide show. आता है यहाँ है, देखिए वहाँ का क्लिक करिए. Whenever I see Dr. Piyush Joshi, कहाँ है मेरे फ्रेंड? बैठिए, आप उठ के कहाँ जा रहे हैं? अच्छा ठीक है, ओके, थैंक यू. आप उनके गले में देखे कभी? जब ब्रिटिश वाले ने कोहिनूर को चुरा के लेके गए, वो दीवार को टकरा के एक टुकड़े नीचे गिर गए, वो उनके गले में है. ठीक है? That's what we are going to talk. Carbon. The pure carbon is a diamond. And in fact, we feel it is difficult to prepare a medicine from diamond. Right? Did anybody use diamond in their practice? Now, one lady came to me, and her main sentence, what she was telling, these things I don't like. I want to achieve. I have a target. If you see, there are so many drugs which want to achieve. Many drugs have a target. Lux vomica, platina, lacasis, arum metallicum, ignitia, natrum muriaticum. Many drugs. But the way what we express our target, Dr. Kalpita has a target. He has to do this by hook or crook. So he did it in a very magnificent way. In fact, it was decided long back in Baroda, 7th Jan, only one day late. So, many drugs have got, but there is one drug which is prepared from diamond. That drug's name is Adamas, Adamas. It has a drug picture, it was proved, but it is not into a practice, and I have never used. This lady's drug picture, when I was going through the case presented by the assistant, then I have seen, because it was one national conference in which I wanted to present on carbons, so I was reading about this drug, otherwise I wouldn't have remembered it at all. Yesterday, Dr. Nirpama was asking, so the same thing, like she tells about 4th row, 5th line, very difficult. I don't remember. So, this drug I wanted to give to her, not because I wanted to experiment, but because when I have seen the drug picture, it was flashing in my memory. And then I prescribed Adamas to that lady. And after 15 days, instead of 1 month, she came back and said, whatever drug you have given, looks it is working, but I will not come again. Last drug you give me, I am going. She went to Dubai. Nowhere, no connection, nothing. That was only one occasion I have given. So there is a drug which is prepared out of diamond, which is a pure carbon, but we don't use often. Because that drug picture, though we come across, it mimics like a platina. It mimics like a lacasis. It mimics like arometallicum. So those drugs influence our prescription, and we most often prescribe those remedies rather than this. And when you do, there were so many dreams also. She had a lot of dreams. All these things. That drug picture, of course, is a different one. So, next. So I thought, next, we would go into this. We know carbon. Next, please. Now, in fact, Hahnemann proved 3 drugs: Carbo animalis, Carbo vegetabilis, and graphites. One is from animal source, the other is from vegetable source, the other is a mixture, third one. The first one is a pure diamond and very difficult to extract also. And when you see other drugs where carbon is there, calcareous carb, kali carb, natrum carb, it is mixed with some other element. So that we don't call it as carbon group of remedies. Next please. Right? So, next. There are so many impurities in each carbon drug. The only pure carbon drug is only carbonium 1. That is difficult. We don't practically use. Most often, many practitioners use 3 drugs: Carbo animalis, Carbo vegetabilis, graphites. There is one acid carbolic, which is also a carbon remedy. One of the beautiful remedies I have seen when I was in my graduation, when I was with my professor. One man, he walked a long distance due to some some compulsions, and he developed eruptions on his lower limbs. There's a beautiful symptom there. He prescribed acid carbolic, and we have seen the action of that remedy. There are many drugs. Next, please. So there are 2 types of carbons: inorganic and organic. Inorganic, you have got graphites, carboveg, carbo animalis. Organic, petroleum, creosote, benzene, aniline, etc. Organic, we use creosote, but it is a mixture. Carbon is there, but it is a mixture. And we also use petroleum. There is a carbon, but there are many other things also mixed in it. Organic one. Okay, benzene. Creosote, many of you must be aware. Whenever a patient comes, the complaint is nocturnal enuresis. We ask few questions. 1, whether the child gets up and changes his dress, or he continues to sleep. He continues to sleep, the best remedy is creosote. But there are some children. When we ask this question, no, I would never wet my bed. My daddy does it and he throws it on me. That is tuberculinum. So likewise, we can make out. Sepia is also a beautiful remedy. Causticum is a beautiful remedy. Calcarea is also. Equisetum, all those drugs. Then petroleum we know better. There are a lot of delusions also in petroleum. Those delusions are so enormous. They would guide you to take a whole drug picture of petroleum. Most of the times we think petroleum is for skin. It is also for skin, but there are many other things. Next, please. So these are all different carbon remedies: Carbo animalis, Carbo vegetabilis, graphites, aniline sulfate, carbonium, lamp black, that one, coal gas, bisulfate of carbon, petroleum, acid salicylic. Acid salicylic is beautiful remedy for tinnitus. One of the best remedies for tinnitus. If your well selected remedy is not acting, you can think of acid salicylic, carbonic acid, oxide, carbon sulf, benzenum. Next, please. Now, if you see the carbon, as Dr. Kalpit said, we will not talk of theory more. We'll talk of cases only. But little theory is also essential to go into it. So, it's a sphere of action, carbons, skin, glands, cancerous enlargement, mucous membranes, veins, flatulence. Carbovegetabilis is one of the worst drugs for worst flatulence. We think always carboveg, upper abdomen, lycopodium, lower abdomen, and China, whole abdomen. That is for distension. But it is also for flatulence. Next, please. These are all like skin, glands, mucous membrane, veins, GIT, occipital region, headache, occipital region. One of the best remedies is carbo animalis. Bones. Next, please. So, carbonitrogenide, sober and clear, and rigid, straight. Even in their constitution, mental makeup, carbons are rigid and straight. Next, please. Loss of vital fluids, emotional stress, mental or physical stress, overlifting, cold air, sexual excess, overeating, wrapping up, sprains. And we know the indispensable action of carbo animalis in sprains, easily sprained. They tilt, they get sprained easily, faster, very quick. So you can think of carbo animalis. Next, please. Common mental, sluggishness, hard working. We are all hardly working. This fellow is hard working. Very spiritual. This is very important. All carbons, by and large, they are not materialistic. They speak of some religion, speak of some solace, soul, all these things. And they have fixed ideas, confusion. They always speak of values. Highest immoral, unscrupulous fellow in our Metromedica is anacardia, unscrupulous. Nana Patekar in Ab Tak Chappan, he can kill his own wife. No scruples, no principles, no attachment. Carbons are completely different. They have values, principles, spiritual, and they have this type of mentality. They give meaning for every damn thing. If you're talking something, they'll tell, no, this has this meaning. Actually, this is because of this. Then, of course, they can go to the extremes. Self-respect and dignity is very important, very aristocratic. Among all of us, who is aristocratic? Kalpit is aristocratic. Okay. He is Junior Modi. They have stately manner and nobility, shyness. This is one, in spite of all these things. Now, for example, carbon and aristocratic remedies, like arsenicum album is aristocratic. But arsenic has anxiety, apprehension, fear, but not timidity. So, the elements of these negative qualities in each remedy would separate them from the rest of the things, even if there are some other drugs which are nearer or similar to that. And there is, like, they shrink back from danger. They don't face. If there is a danger, they will go into a shell and arey nahi chhod do, nako, leave it. Next, please. And physical symptoms, burning, offensiveness. When I got married first time, everybody gets married first time, don't think that. There are many people who get married 2-3 times, Hahnemann also. So, first and last. Okay. My father-in-law was a little kind enough. I didn't take dowry. I couldn't because it was a love marriage, so I can't. Then, my father-in-law gave me a refrigerator. Jaan do, yaad karega bacha. And we went out on a vacation for a week. And when we came back, It was stinking, the refrigerator. So obviously it becomes. And what we do usually, when we are going out, we switch off. Arey, current kharch ho jayega. Right? Nowadays I can't reach the plug also. It is so hidden behind the refrigerator, you can't reach it to switch off. So then I called Godrej fellow. I asked him, अरे यार ये बहुत बदबू आ रहा है, स्टिंकिंग है, क्या करना है? बोले आपके पास चारकोल है? चारकोल? हाँ, उसमें लगा दो. सुबह लगा दिए, शाम तक गया. They can absorb offensiveness from any source, and carbohydrate is such which can absorb the putrid situation in GIT or pus or abscesses, these things. It has the capacity. Ulcers, varicosities, capillary circulation engorgement, glandular abscess. Next please. Aggravation from music. I have a case which you will see the music aggravates her. When it is not palatable, music is also a noise. When they were playing Gananayakaya, so Nirupama was dancing almost in the chair. So it is music to the ears. But if you cannot bear that, it becomes noise. So these carbons cannot bear the music. And 7 p.m., there are many drugs, lycopodium, pulsatilla, tuberculinum, many drugs which have got that 7 p.m. aggravation. Why 7 p.m.? Mostly, if you analyze, husband comes home at that time. Cold draft of cold air, damp weather, fatty food. Many drugs have got fatty food. Graphites is equivalent to pulsatilla. If you see in Allen's keynotes, what graphites is it? What is that sentence? Pulsatilla and graphites. Sentence in Allen's. Puberty. Open air, walking after eating, touch, rest and heat. Next please. This is first case, 53-year-old, DFO, bleeding per rectum since 1 year, red blood, before the stool and also some blood mixed with the stool, cutting pain, aggravation morning, ineffectual urge for the stool. He went to Apollo in Chennai. Usually in Nellore is such a custom that if you sneeze for 6 times more, they go to Chennai, 150 kilometers. Okay, next. So, typhoid 9 years, sleep disturbed, aversion to sweets. Then he will never be a gujju. Impossible. My friend who is a principal in Baroda, whether he is still there or not, I don't know, Telugu man. I came to Baroda long ago, first time. And he took me for a dinner and he said, sir, these people, except in water and salt, they add sugar to everything. Yesterday, who was telling me? I think they add vanilla powder to sugar also. Great. Okay. Next. Obese, chilly, tongue mild white coated, abdomen distended, diagnosis, colitis. We have that diagnosis. Next please. Nux vomica, sulfur, ratania, kurchi, markar, they were all used earlier. These are the common drugs. Whenever a patient comes with those symptoms, we all prescribe. Right? So we decided to do the repatriation. Next please. Which usually I don't do. Obese, chilly, aversion, blood, difficult to pass stools, ineffectual urge. Next. Next please. So then graphites was the remedy. And 70% of my prescriptions I prescribe 50 millismol. So I have given 0/1. And after quite some time, maybe 3 months or so, we have asked to go for colonoscopy again at the same institute because it's physician oriented. Next please. So it was colitis with ulceration, Vijaya Health Center, very famous. Dr. Cherian is the famous cardiologist attached to this Vijaya Health Center. Next, please. And when we have treated, normal, steady. So same Vijaya Health Center. So this is what like graphite has that capacity to go to this extent of removing these obstacles, correcting the inflammatory changes, even the ulcerations, because of its sphere of action. It is one of the best carbons, inorganic carbon. Next, please. This case is a very beautiful case, which has made me learn quite a lot of things here. 54-year associate professor. After a long journey, he drove his car along with his family to a vacation site, and it was a long journey up, and then roamed around and went to other places and came back to Hyderabad. And then he started getting pain, severe pain, left hip joint. Okay. He took arnica. He has a kit, medical kit. Most of the people do take some medicine. So he has taken. Pain in low abdomen, aching, aggravation on inspiration, on walking. Then pain also in the lower back, especially after sex. This was something peculiar. Most of the times, in general, we think that the man who has a low back, he may not indulge in sex, but that is also a common factor. This cannot be taken for granted. We have to be a little careful in taking the case and ask what are all the modalities and what will happen. There is nothing wrong in probing it, even giving him a hint as well. Next, please. So he was investigated thoroughly. Diagnosis was very, very difficult because Cox and malignancy were ruled out after extensive investigations. One doctor said it could be Cox. The other doctor said it could be malignancy. Next, please. This is what like orthopedic, all these things. It was like here, Montus was positive. So the doctor already started some drug, maybe for Cox, I think, yeah. Next, please. And when this CT was done later, there was absence of pubic ramus. This cannot happen with long journey. One bone suddenly disappears. Can it happen? Difficult. So it cannot happen. So there was a lot of tension. First, we should know the diagnosis. Cox, at least 6 to 9 months treatment in allopathy. The patient could be all right. Malignancy, at least some treatment can be initiated. But what is this? Why the pubic ramus has disappeared? Next, please. It was diagnosed as Gorham's disease, vanishing bone disease. Very rare condition, very rare disease. In fact, I had to ask him to consult Dr. Kakarlu Subbarao. During his times, he was one among top 10 radiologists in the world. He was practicing in New York. He was brought back to Hyderabad by N.T. Ramarao, and he was the director of Nizam's. So I went and met, and I requested. Then he saw the CT scan, and he said, it is Gorham's. First time I heard the name. First I asked, please spell it. But we don't know. Yesterday I was sharing with my friends, like there are many drugs names which I hear for the first time, and I think whether it is homeopathy or allopathy. So there could be so many such occasions. So next, please. If you think about it, this is the area. You don't see the pubic ramus. Here there is a pubic ramus, but here the pubic ramus is missing. So that ramus disappeared. Next, please. And if you learn from this is what like it has been mentioned, CT scan, later it was taken, and I asked the radiologist to look into it, take care, all those things happened. It was a big drama, a saga for almost 2 months. Next, please. So if you see, it's a rare congenital disorder. Very rare. 1 in 1 million, if I remember well. It was first described by Gorham in 1954. Okay, next. So pathologic fractures can be there, acute or chronic pain. Initially it was acute, and there would be a consistent chronic pain, and the disease is progressive. It could be progressive because it does not stop there, and for it to disappear a bone, it would have taken years, and later another bone. So gayab. He will become soft toy. Okay. Next. So for this, patient is non-diabetic, non-alcoholic, but smoking is there. And long journey, all these things I have given Rostox. Yesterday Dr. Shobha was telling Hekla lava, one of the beautiful drugs for calcanean spur. If you don't have any symptoms and you are not matching with any drug, calcanean spur, Hekla lava is the best remedy. So we have given everything. Syphilinum, thinking congenital, blah, 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 nothing. Calcarea carb, bone, no. Then we thought we would do the repatriation. Whenever we are stuck, we go to the book. Till then, we are masters, we feel. Next. So, the wife had only one major problem. He is becoming very forgetful for the past 4 days, forgetting the latest things. You have seen, what is that Amir Khan's movie? Gajani. Because I also forgot recently. Recent memory is gone. So that recent memory is gone. There are many people. In fact, nowadays, please remember, if the patient were to tell or attendants were to tell you that this person is forgetting what he has eaten in the morning, but he remembers many things, it is earlier signs of Alzheimer's. Okay. So I had
सर
ये ले लो, ये अच्छा है, थैंक यू. ये बाथरूम में क्यों गए? ठीक है, anyway. So, this Gajani type of memory loss, there are two important remedies in our Mitra Medica. What are they? Anacardium forgets many things, not just recent past. Medorinum forgets names, chronic forgetfulness, and even the recent one. Lacanum forgets the shopping, whatever has been done, and leaves there. And all of us, we forget what we read in the morning. That is not a symptom. Okay. What else? Graphites, Rostox. There are two remedies which have loss of recent memory. Okay? I had one lady, Punjabi lady, who was brought by her son to the clinic, and daughter-in-law accompanied the son. So when the whole case was taken, I looked at her, and she immediately looked at her son and said, "ये पुत्र, ये लड़की कौन है, हमेशा तुम्हारे साथ रहती है?" उनको सिर्फ पाटियाला याद है, हैदराबाद याद नहीं है. Recent does not mean today. Comparatively recent, and maximum past is remembered. She remembers Patiala wala, unka shop, unka sab kuch. She doesn't remember that she has shifted to Hyderabad and now she has a daughter-in-law and a granddaughter. So that is Alzheimer's, right? She had so many bony problems, other things. We have given Rustox, 10M, 50M, CM. Lot of recovery, but she died after 10 years out of old age. You can't stop that, right? So here, basing on this, I have given graphites to this person. 0 by 1, 0 by 3, 0 by 6, 0 by 9. Now the major question remains, after the remedy, Dr. Praful Vijayakar showed one case where he has treated and the finger has erupted. Will the bone come there? This is a big question in my mind. Or, at the most, what will happen when you have given the medicine? This is called as a prognostic criteria. We should have a prognostic criteria. Whenever we start treating a patient, we should fix up the prognostic criteria. For example, a chronic renal failure patient comes to you and you have taken the serum creatinine which is 18 and there is edema. The BP is 190 by 120. There are quite a few other symptoms. Urine is oliguria, all that. Now what would be your prognostic criteria? You have given medicine for 3 days. There is a breathlessness, waterlogging condition. So the priority should be to see two important things. The most bothersome symptoms in the patient and the blood pressure. Blood pressure is the clinical indication of CRF, whether it is responding to your remedy or not the creatinine. Because creatinine would take a longer time. For it to reach 18, it would have taken ages. Now it will take the same pathway. So if you check the creatinine and say, my drug did not act, and you have changed the drug, you will be a failure. So similarly, we should have a prognostic criteria in this case. What is that? Of course, very emotionally I felt bone will come there. Because in one case, which I have presented in our NGH webinar, my wife presented, Dr. Aruna, where when she treated a girl where there was Mullerian agenesis, and she got back her uterus, ovaries, which were not at all there. And now she has a child also. So that, I thought at least I should match with her so that the bone at least grows. Or worst comes, what is the major problem in this disease? It's a progressive disorder. So if you can stop it, then you are 50% better. So we have taken the MRI. Next please. When compared to previous CT of 11th September, there is no significant change. That's what the report. So we felt happy. Now this has happened in 2009. And 14 years since then, he comes to me for only off and on cold cough fever, but never for bony pains, never for joint pains. He is very happy. His whole family are with me. His mother is being treated for her breast cancer and she is alive. She is 82 or 83. So, here that is what the quality of the remedy which you prescribe correctly, it would stop it at least, because it has that capacity to progress. And if the progression is stopped, many people who come for alopecia, bald head, and you cannot assure them that you give the medicine and ball will come here. No. Even Hanuman did not have ball or hair. So you can't assure them. But at least you can try to stop the fall. If you can, you are 50% successful. That's what we thought. Next please. Next. So little about graphite. I'll just scan through faster. Sushma, are you alive? You said 5 minutes before you will warn me. Because I don't know the time. 5 minutes are there. When I ask you, my God, fast, fatafat. We have one more case also. Next. Okay, next. अब ऐसे चलते जाना, ठीक है? Because it is all like mixed. Graphites is not in pure form. women inclined to obesity, habitual constipation, delayed menstruation. Pulsatilla is at puberty, graphite is at climacteric. Next, please. Grief, fear, overlifting. Next. Mind, excessive cautiousness, timid, that's the sign of carbon. Hesitates, unable to decide about anything. Most indecisive remedy in our Metromedica is pulsatilla. Faster in taking decisions is ignatia. The world of difference. Want of disposition to work, which is there with all of us. Next, please. Sad, despondent, music makes her weep. Next, please. Fast. Children, graphite's child is one. If the mother scolds, hey, pagal ho gaye kya? So that is what like. You feel, अरे पागल रही, सच में पागल हो गए, क्योंकि डांटे तो हंस रहा है. Okay, right. Takes cold easily. Immoderate laughing, natter muriaticum child also. But that child, like an autistic child, self-laughing and laughs when it is not the time. All these things. Even a young girl, natter muriaticum girl, you can make out among the crowd also. She suddenly, you will wonder, अरे पूरे कंपनी में क्यों ऐसे हंस रही है? उनको उनके बॉयफ्रेंड गिफ्ट दिया वो याद आया. So because that is what like natrium muriaticum. I have seen quite a lot of girls pushing other girls, thinking you have done that. Okay. Now, that is because they don't live in the present. Natrium muriaticum always lives in the past. There are two factors in natrium muriaticum. They always remember disagreeable events. आप उस दिन मुझे गाली दिए, वो याद रहता है. उसके बाद गिफ्ट दिए, वो याद नहीं रहता. गाली दिए याद रहता है. तो ये सब, but always positive thinking is phosphorus. Very fast. Like if you have a girlfriend or a boyfriend who has phosphorus nature, you would be very happy. If you have natrium muriaticum, very difficult. Not that that fellow falls in love with rickshaw puller, but that it is very difficult because the emotional expression is different. So decided aversion to coition, even pulsatilla also has, but after little evolution, pulsatilla does not like opposite sex, whether male or female, does not like. Unhealthy skin, next please. Next. This actually graphites has a beautiful description in Alan's keynotes about skin, watery, transparent, sticky, discharge. Wherever you see, then you can prescribe lacquers, graphites, because it is in bold letters. Next please. Next. Jaiye. No problem. We will go to the case. She doesn't have time. Okay. Next. Hard cicatrices. Like today morning we were discussing, Dr. Nirupama was asking, the drugs which have the capacity to break down the fibrous tissue, thiocinamin, silica, causticum, graphites, calcarea fluor, these are the drugs which have the capacity to break the unnecessary fibrous tissue. Because you will see unnecessary fibrous tissues in keloids or some areas where it should allow it to grow, like one case which we have got it published in our NJH, where the lady had a fracture and it was not healing because of fibrous tissue in between two bony components, fractured segments, and when acetic acid was given, this is another drug. It has the capacity to break that fibrous tissue. Next please. Skin, next. Eczema, unhealthy skin, common in graphites. Nails brittle, this is also very common. Now we see quite a lot of cases of psoriasis because it's an autoimmune disorder, lot of friction. So psoriasis is very common. This is like, this is one German photo I had. This girl, typical graphites type. Next please. Translation is there. Phlegmatic, blonde, fat, 80 years old girl. So the measurements D6, D30 for genital eczema. She was cured because of physical constitution and the description of symptoms. Next, please. It was not by me, that was in Germany. Now, last case, 34-year, this lady, irregular and scanty periods, great aversion to the coition for the past 6 years. Next, please. Husband was mentioning, the lady does not mention that most often. One old man came to me, old around 65, 66, and he came and said, सर आप मेरे बीवी को ट्रीट कर रहे बहुत महीने से, लेकिन एक खास सिम्टम बोलना है. You people are all doctors, so you don't mind if I am talking little sensitive words. Now, तो प्रॉब्लम ये है साहब, मैं कभी भी उनके पास जाता हूँ, ऐसा करती है मुझे. मैं बोला डोमिनेशन होंगे, डोमिनेट करने, नहीं डोमिनेशन कुछ नहीं है. जब भी मैं इंटीमेट होने की कोशिश करता हूँ तो शी पुशेस मी. Then I said, why? And since how long? There are many drugs in which the lady pushes the husband. But what is the reason? Why? So when we probed a little, he said she has tremendous sensitivity in her genital area. It is there in platina. Vaginismus. So I have given platina to that lady. All other symptoms also vanished. Because I was not thinking of platina whenever she was talking to me nicely. This is very deceptive of platina also. Not always the platina lady would show off in such a way that haughty nature is shown to you. No. When you are a doctor, she would talk 10 minutes, 5 minutes over. In that conversation, you may not be able to spot real platina. So through this symptom, we could extract. Anyway, here she was a lazy person, does not have inclination to do any work, started hating her husband, lest he may approach her for sex. She cries very often, at times without any reason, common with ladies. Please don't beat me. She has 2 children studying in a very good school. Next. Even many times they don't know why they are crying. आप क्यों रो रहे ऐसे ही टाइम पास, तो वही एक प्रॉब्लम है. Okay, this is the greatest problem. Whenever anybody switches on the TV or music system, she would yell at them and say, "Stop it! बंद करो ये हल्ला गुल्ला." तो वैसा. Next. This is another thing. She herself told me, मुझे हमेशा लगता है मैं पागल हो जाऊंगी. You will wonder, अभी नहीं हुआ क्या? Next. Right. So she had this beloved uncle 12 years back. He died and she was very much attached. So there is a grief, there is aversion to sex, there is aggravation to music, and we have got that. This I wanted to check. Fears that she may go insane. Is it there in graphites? Because I did not remember. So when I checked in repertory, graphites is there in 2nd grade, I believe. And then I jumped with joy and prescribed. Next, please. So we gave graphites. Our TSH was 50.37. In fact, this point should be here for normal person. Just change. Next, please. Hypothyroidic patient. Next. These are all the rubrics which were taken. Next. Graphites. And then TSH. We have given graphites 200 once and repeated next. That's all. Total 2 doses only. Next, please. This was 50.37. Next. Came down to 1.3. Now the big question in my friends' minds would be whether the husband spoke again or not. Okay? Will he come back and tell me, "Thank you, sir"? Will anybody will? He won't. I may charge more. He will think. इसका भी consultation का double पैसे दे दो.
but I got a hint. How are you? Thank you, sir. So that is enough. You don't need to probe further. Okay. Next. Thank you. You are all happy with it. Sushma is also. Thank you very much. If you have any doubts, ask Dr. Kalpit. Thank you.